During this COVID-19 pandemic, there has been quite a lot of talk about using hydroxychloroquine, an anti-malarial drug, as a treatment for this new coronavirus. It was especially brought into the public's attention because the US President Donald Trump tweeted that hydroxychloroquine and azithromycin have the potential to be game changers and could treat COVID-19. Reportedly was even taking it daily as a prevention. But what does the science say about the use of hydroxychloroquine for the treatment of COVID? Liana and Theodoridis has recently published an article about this in The Conversation. Liana is doing an honors project in Dr. Teresa Caravalho's laboratory at Trobe University. She is investigating if newly synthesized spiral compounds could be used to treat malaria. Firstly, could you give us a bit of information about hydroxychloroquine? What is it used for?
So chloroquine and hydroxychloroquine are both prominent anti-malarial drugs, and they've been used to treat malaria for the past 70 years. And not only that, they've actually been used to treat some autoimmune diseases as well, including systemic lupus and rheumatoid arthritis. So they've proven to be versatile drugs, but they haven't been approved to use against COVID-19.
Malaria is caused by a parasite infecting the blood. COVID-19 is caused by a virus infecting the lungs. How could hydroxychloroquine be effective against organisms that are so different? So, you've told us that hydroxychloroquine has been used to treat malaria for over 70 years. You also explained that scientists think that they know how it could be acting against viruses. Overall, hydroxychloroquine seems to be great to treat COVID-19, isn't it?
Well, yes. Using already existing drugs and repurposing them for other infections can be really beneficial in emergencies like this current pandemic, because we already know so much information about these drugs. We know the maximum doses, we know their potential side effects, and we know that they're safe to use on humans because we're still using them after 70 years. But we're not yet sure if these drugs will work against COVID-19. In comparison to the previous SARS coronavirus, COVID-19 has a 20% genomic difference, and that is a lot. There is still a lot we don't know about its biology and how the virus works. So we can't assume that because these drugs worked against SARS, that they'll work against COVID. Another thing we need to think about are the side effects of chloroquine and hydroxychloroquine. Using these drugs for long periods of time can lead to severe consequences, such as vision impairment and cardiac arrest. And these side effects can be more severe in people with pre-existing health conditions. So it's really important not to promote these drugs unless we are 100% sure that they're safe for everyone. We simply cannot use the doses of hydroxychloroquine that are prescribed for the treatment of other diseases when it comes to tackling COVID-19, because that particular dose might not clear the infection. So further study needs to be done before we really start using this as a treatment.
You made it clear that more work needs to be done to see if hydroxychloroquine could be used to treat COVID-19. Have there been any studies so far to look into this?
Yes, there have been a few studies on chloroquine and COVID-19. Some studies reported positive results and claimed that chloroquine could work against this coronavirus. However, all these studies have had drawbacks. They either used a control or experimental group that was too small, or they were not able to explain in detail how they got their positive results or how they conducted their study. There's also studies that have shown that these drugs don't work, and in fact have had quite significant side effects. There was a hydroxychloroquine trial in China that didn't show any significant change in recovery, and another in France where 8 patients had to be taken out of the study because of heart complications. So the evidence available at the moment is very conflicting. But if we want to progress and find a suitable treatment for COVID, we can't put all of our eggs into one basket. We need to spread our attention evenly into other potential drugs. So HIV drugs and antidepressants have shown promising results. So some scientists argue that it would be more beneficial and a better use of our time to try and investigate to see if these other drugs work too.
Since the science is not settled on this question yet, why is there so much talk about hydroxychloroquine? Could this new hype have adverse effects?
Yes, all of this talk about hydroxychloroquine and if it can work for the treatment of COVID-19 has actually had some pretty negative effects. This crazy fascination about these drugs has led to a lot of people hoarding and self-medicating to treat or prevent getting an infection. Taking medication that you weren't prescribed in the first place is really dangerous, and we've seen a man in the US die from inappropriate chloroquine consumption. So this can be really quite detrimental to the public. And there's more. Because these are prominent anti-malarial drugs, this hoarding can potentially lead to drug shortages in endemic countries or for people that actually need to treat malaria. This could impact our current malaria control efforts if we don't have enough drugs to treat people during this transmission season.
What do you think needs to happen next?
Because there isn't enough evidence supporting the use of chloroquine and hydroxychloroquine, we really need some thorough clinical trials that monitor patients for extended periods of time. We shouldn't rush into something that we're not 100% certain about. So I think the need for further studies is really.
Thank you very much, Liana, for your time, and thank you very much for watching until the end. Please find the conversation article in the description of this video. Feel free to type in any question you could have in the comments. Liana and Teresa will do their best to address them. Thank you.